you go. That ability, professionalism, passion, problem-solving ability. And it says the evaluator is required to write at least one page commenting on these attributes. It is the responsibility of the students to get to know the evaluator well enough in order for him or her to have a proper ammunition to write an in-depth evaluation without adequate letters of recommendations from even some students with the highest grades and test scores are simply discarded by the admissions committee. Most medical schools require that you have a total of 3 letters of recommendation, 2 from core science courses and 1 from non-science evaluator. Now here's what I would suggest that you guys try to do is, even though it says 3, if you're a biology major, you should try to get 2 letters from 2 biology instructors. And then 1 from chemistry and 1 from physics. Why do you think that is, Nick?
Just shows that you're an all-around, well-rounded student.
The disciplines are different, aren't they? Physics talks about problem solving, so you think in different directions. Organic chemistry is also good from that standpoint. Biology is different, but ideally you should have about 4 letters from the science core, and then 1 from the humanities or physician that you work with additionally. But most people don't know enough of these instructors or get to know them. So in a class of, say, your class size is about, how many of you are in the honors college? Well, you're lucky in a sense because we have small class sizes. You can network and get to know people quite easily. But in large classes, you have to be proactive. So at the end of the first year, you have to get to know at least 2 people. So you write their names down. So at the end of the first year, you go talk to these people and find out if they are empathetic, if they are willing to write letters for you when the need arises. At the end of the second year, sophomore year, you should have at least 3 people who are going to be your advocates. Right? In the junior year, another 2 or 3. So you'll have a total of 7 or 8 people in your list. Now, after you talk to them, you probably get an idea as to if these people are willing to do a good one for you. You can ask them. And whether they are willing to do a good one for you. You can also ask that question. So, what is the best way for you to get to know these people, these evaluators?
Get to know your professor outside of class.
Well, yeah, go during office hours, ask questions. Even if you don't have any questions, make up some questions, do homework. You know them. Huh?
Even if you don't know, they offer, you can take your professors out to lunch.
You can
might
do
be
that.
a little awkward.
You can get to that. Honors
It's
college does that.
I don't
Take
think it's
them out to
awkward.
lunch. And then often do some volunteer work. Do some independent, if you can, do an independent research project for 1 semester. That might be helpful, but volunteering is something that most professors welcome. So you should put your name down that you come and volunteer. If you do it because you're going to do it well. And then this way, the person writing the letter will be able to better judge your personality, your level of maturity. You come and you say you will come, and your work ethic, organizational skills, all these things that are written here can only be evaluated if you get to know these individuals. And also you get a sense of, when you talk to these people, get to know them, you will have a sense of trust. Because whoever writes a letter for you has to be absolutely honest, brutally honest. Nothing negative should be mentioned. Right? So nothing negative. So you've got to get that feeling of comfort before you do this. And remember, these recommendations are very important because they are very objective. Grades are subjective, your personal statement is subjective, interviews are subjective, but letters of recommendation that somebody else writes on your behalf, written by someone who's older than you, is considered very necessary. Dark, you listening or falling asleep?
No, I'm listening.
Good. So, what they said, 4 letters of recommendations to the science group. Get to know them, do an independent study with them, or volunteering is good. Suppose Graham is teaching organic chemistry 333, and these days with budget cuts and so on, he may not have enough teaching assistants. He could offer to teach with him, like teaching partner, TA educator. Spend some time with students, answer questions for students who are taking the class. This way, if you're writing a personal statement, you can actually say something about your ability to connect with people. Do you like to do that or not? Because teaching requires a lot of patience, doesn't it? A lot of patience. You will know. So, any questions? And also, yeah, I think I've summarized everything. Graham said that he would put this on the email circuit. I'm sorry, I was going to make some copies and bring it to you guys for the team course, but it didn't happen. So I'll leave it here. If you have any questions, you can ask me, email me or something, but make sure that you do your letters of recommendation. They're very important. Don't take it lightly. Don't wait till the last moment. Give people enough time, 3 months, 2 months, to do it. Right? Any questions? Anybody? Nick? No?
Okay, I got it.
Got everything? You sure?
For the most part, yeah.
Alright. Then Graham is going to come up and introduce Dr. Estes, so I'm going to step down.
As a reminder, what he said, I'll send out the sheet that he's going to bring, just the email copy of what it looks like to have a good recommendation letter if you want to glance at it. And then obviously, feel free to talk to him about it afterwards if you have any other questions. Our next presenter is actually a dear friend of Dr. Handy's. He actually attended undergrad here at the University of South Carolina, went on to graduate medical school from the University of School of Medicine in Columbia, and did his residency in Charlotte, not too far away, before returning home to practice OBGYN at Lexington Women's Care. So I would like you to welcome Dr. James Estes to this.
I'm really surprised, I told George this earlier, surprised that there's so many of you out here right before finals are starting. It's pretty cool to see this.
Can I say something before you start?
Yes, please.
Alright, Jim Estes, I got to know him a long time ago when he was a student. He was in the honors college. And at that time, they didn't offer, he's a very smart guy, they didn't offer an honors or majors lab that would fit his schedule. So, to get him to do that lab, I had to babysit for him on Tuesdays and Thursdays for about 5 or 6 hours. So he was doing the work, I was sitting in the same lab. He had any questions. He always did everything very quickly and left. So because I helped him, he offered to work as a teaching assistant for me. So the following year, he worked as an undergraduate teaching assistant. He taught the lab, he helped me with the class. He actually helped me run that program very efficiently because we have fewer students. But he had exceptional leadership skills. He's very organized, dependable. I think one time we had to go to Sri Lanka or something, and then it got delayed. And he was here this summer.
You were actually gone for like the
Gone for
entire
the
summer
beginning.
session.
So I could count on him more so than graduate teaching assistants, and all this for nothing. This is a volunteer. So Nick, take heed. But that's how I got to know him, and I got to know his family, and we've sort of stayed in touch ever since he left USC. He was also the president of a social club by name of Sigma Chi. And then he was also the president of the American Chemical Society, student affiliate program, and I was the advisor. So both of us, along with our office bearers, we organized a fantastic symposium on, it was on imaging. It was on proton spectroscopy and imaging. Got some well-known people to come and speak. A huge audience. It was a 2-day symposium. Remember?
Oh, yes.
It was Friday, Saturday. We had banquet or dinner or something, all done by him. So he's got very good organizational skills, and so hopefully you guys, when you're in college, you'll develop some of these skills and use that towards your application in medical school.
You didn't mention the non-academic slave labor you got out of me, like moving furniture and walking dogs.
Moving house. Moving house is done by you, Sheriff Burgess, yes.
Oh, by the way, Dr. Handy, Morgan was supposed to come in and clean your room, but you weren't there today, so the slave labor that he's talking about still exists.
Who's Morgan?
Dr. Handy.
Oh, Morgan's still in my class.
Yeah.
She was going to come and help me?
Yeah, she said she'll be back by tomorrow.
Alright, so I interrupted you. Go ahead.
Write his email.
I'm curious, raise your hand. I don't think, are there any freshmen here? Sophomores? Juniors? Wow, seniors? Wow, really few know that they're being seniors here. So seniors are well into this whole process. Are there any seniors that have already been accepted to medical school? Okay, that's a good feeling right now, isn't it? I was fortunate enough when I was going through all this to get my acceptance letter like right at Thanksgiving weekend, and wow, that changed everything. Took a lot of pressure off, and I sure did enjoy the rest of my senior year a lot more after that. We talked a little bit before, and George has got me to come in and do this a couple times in the past. I guess the biggest thing he wanted me to do is talk about educational requirements, how you get through the whole process. I would think that everybody here, if you're seriously looking at going to medical school, you know about the whole process of application, medical school, time that goes into that, residency. So I don't want to waste a lot of time boring you with things. For OBGYN, you do the typical 4 years of medical school, 4-year residency. I'm expecting that to change in the very near future for OBGYN. About 10 years ago, they put in some serious requirements and limits on how long residents could work. We were putting in, on average, 110, 120 hours a week, which is just crazy. And I think the number now has been capped at 80. So, you know, we've got 10 doctors in the group, 8 of us in the call schedule, 2 that aren't doing OB anymore. But the 2 newest associates had never done a full weekend on call before. They'd done a 24-hour stretch, but had never been there for 48 hours where you could be up and having to make decisions and taking care of people. So that was a new experience for them. As you're figuring out what you want to do, wow. My best advice to you, when I was first applying, I was absolutely sure that I wanted to be a pediatric surgeon, no doubt in my mind. Went through the whole application process, talked about all that. Got through my 3rd year. The 1st year, and you guys probably all know this too, the 1st year is basic science. 2nd year, you go from the normal stuff to the pathologic side of it. And then 3rd and 4th year, clinical rotations. 3rd year, pretty much everywhere in the country is about the same. You do set rotations. There's very little elective work with that. 4th year, you get to do a lot of electives. Well, getting through each rotation, I was the one in my class was probably driving everybody crazy because I enjoyed it. I was having fun. I got the clinical rotations, and it's just, I mean, that's what you've been working for. The problem was I really enjoyed each rotation, so I wasn't sure what I wanted to do then. Went and sat down with O'Neill Barrett. He was the grandfather of the medical school at the time, and told him I was struggling. I'd already set up my 4th year electives and what I was going to be doing at externships at different sites, but I wasn't sure about what I wanted to do. And his advice to me was, well, when it's right, you'll know. And I'm thinking, well, thanks. That really helped me a heck of a lot. So the next week I started my OB rotation. And first day in, I get sent over after our little orientation stuff. I get sent over to labor and delivery. I'm the one, the student on call that day, and walk into labor and delivery, and it's just crazy. Residents don't have time to even stop and speak to me. And one of the older nurses grabs me and pulls me back into a delivery room and said, "Come on, we're going to deliver a baby." And I'm thinking, okay, well, this will be cool. I get to watch somebody do this. And this is at Richland. Walk in, and it's the patient, the nurse, and me. And I hadn't even read about this yet. I had much less seen it or had a clue about what we're doing, and I was a bit scared. And she says, "Don't worry, I won't let you hurt anybody." And we went through it. It was the most amazing thing I'd ever seen. For me, you know, Dr. Barrett was right. When it felt right, it was real clear to me what I wanted to do. With OBGYN, you get to do as much surgery as you like, so if you like surgery, that's awesome. For most of your patients, especially the younger patients, you're their only doctor. So you do as much primary care, as much basic medicine type stuff as you could possibly want to do. You do as much adolescent. I love peds. You do as much adolescent stuff, unfortunately, way more than you would want to be doing with what we do. But lots of adolescent medicine, lots of psych. So worked out perfectly for me. Now, what I didn't understand when I first decided to do that was that OBGYN also entails a lot of sleep deprivation. And if your body doesn't deal well with that, then you probably don't need to be doing that. So that's one of the advantages of going through the clinical rotations. You get a little taste of each of those areas and figure out what you want to do. As we're going through, if anybody has any questions, any comments, just hands up, speak. Don't be shy here. Okay, so that's basically my background. OB's residency may go from 4 to 5 years in the reasonably near future just because you're not getting as much surgical experience. When I came through 21 years ago, finished my case list, I've been the primary surgeon on 1,400 cases. When Valerie Skinner, who came through, joined us about 8 years after I started. When she joined us, her case list when she was coming out of residency was not 1,400, it was about 800. The two most recent that have come out because of the hour limitations, they came out with a major caseload of about 400 apiece. That's a problem. You guys are counting on these people to take care of you, and they're not getting the experience. So fortunately for us, with our group, we're large enough, we're able to continue mentoring and getting them in, assisting us in surgeries and basically extending the residency for surgical experience. But if you're in a small practice, a 1, 2, 3 person practice, you're not going to get that. So I do expect that to change down the road for OBGYN, probably for general surgery too. All right, George also wanted me to talk mainly about goals, getting into medical school. I guess the 3 things that I would guess all of you have as goals right now. Number 1, getting into medical school. Doing that and minimizing debt while you're doing it. And then having some quality of life as you're going through it and then afterwards. And the third one, I can't stress to you enough as you're going through this, if you're not paying attention and looking and figuring out what you want, what your quality of life, what you want it to be going down the road, you're not going to be happy, because you will work your butt off, you will put in decades of long, hard hours, you'll be well rewarded for what you do financially. But if you don't have things outside of that, then whatever that may be important to you. For me, I knew I wanted to be married. I knew I wanted to have children. I knew that I wanted to be able to spend time with my kids. I joined a large group on purpose so I could do things with my family. I joined a group of people that were like-minded. When I was first coming out, it was down to a group in Charlotte that I really liked, the people I worked with when I was president, and the group that I'm with now. The difference in starting salary, over the first 3 years would have paid for a nice home on the lake in Charlotte. And it was hard to say no to the money with that. But what I've seen over the last 20 years with the guys who were in that group, guys and girls, at least half of them divorced. That's not what I wanted. And what I saw with the group that I joined was people that were as committed to family as I wanted to be. So you got to find like-minded people as you're going forward with this if you want to be happy. I don't think any of us over the last 20 years have missed a family function and something with a kid that we wanted to be at. We always covered for each other. I've coached. Yes.
If you wanted to join that other group when you were younger and weren't married, would it have been relatively easy to transfer into something easier or less demanding when you got a family and you're trying to kind of settle down more, or is it not that simple?
Good, but the tough thing is when you move, if I've developed a patient population there that I've invested time in, and I leave, wherever I go, I'm starting over. If you're going to work as an ER doctor, you can do that.
Okay.
You can move easily from places. If you're working as a pathologist, yeah, you can do that. Those are specialties that would allow you to easily move. If you have a spouse that has to be mobile with a career, yeah, that's something you need to think about. You need to choose a specialty that's going to allow you to move fairly easily. Our pediatrician I helped build his practice, really good guy. A year and a half ago, his wife was offered, she's a psychiatrist, was offered a teaching position, and he basically shifted to his practice and was starting from scratch. But she had basically made sacrifices for him to do what he wanted to do early in their marriage, so it was his turn to do that for her. But all depends on what you're doing. You can do that with what I do. Hey, you can, but it's hard. And if you're starting over with developing practice, you're starting over financially too. There's somewhere I was going before that with that. With kids. Okay, I've coached youth soccer for 21 years. Love it, absolutely love it. I've gotten to be, coach all my kids for years from kindergarten through 6th, 7th grade, every fall, every spring, and most winters we've done an indoor league. That's been wonderful for them and for me. My son is 25 now, married, just had his first child. He was into scouting, so we went through all that. I took one weekend every month the entire time he was doing that. We went camping. I took a week off each summer and went to scout camp with the kids. I had a group of 12 boys at the time that I'd worked with, coaching soccer, and through scouting, 8 of the 12 made Eagle Scout. And now we can give that up for any. But I see a lot of people that are working around me that don't get to do these things, but it's because of decisions they make. You just got to make decisions as you go along. They're going to allow you to do what's important to you. That's something I want to throw in, George. I know you wanted me to talk more about how to get into medical school, but I think just don't lose sight of yourself as a person or what you want, where you want to be in life down the road. See a lot of women in the audience. We've got with our group now, we've got the most female providers in the state in the group. There are 4 female physicians. We have 5 nurse midwives. 5 nurse midwives, 3 nurse practitioners, and a PA. They all have been able to, because of the size of our group, construct things that have allowed them to be professionals, providers, but also be moms. And I think now that's a lot easier to do, but you've got to make